Good evening and good morning to those joining us from another part of the globe. Welcome to the June 2024 Autism and Face Yoga session. My name is Minal Potnis and I'm an evangelist in the technique of Face Yoga. Ayana Face Yoga is a series of asanas or exercises that are sequenced using the 57 facial muscles of the face, the neck, and the scalp. This technique is for beauty, wellness, neuro conditions, autism, MND, facial paralysis. As I said, these are a sequence of exercises using all the 57 facial muscles. And when it is observed that when these 57 muscles are exercised, it stimulates the central nervous system, the brain, and the endocrine glands, increasing blood circulation to the facial muscles, face, the neck, and the scalp. Face yoga is for everybody, those on the autism spectrum, family, friends, and caregivers. It's for all of us. And for our focus of facial yoga for neuro conditions is to rebuild, strengthen mobility, and of course the muscles. Rebuild, strengthen mobility, muscles. So let's commence our capsule for June 2024, the Face Yoga capsule. After which we will have our guest for today, Dr. Tirthankar Roy, joining us. Now, he has been working with patients on the autism spectrum, Alzheimer's, ALS, MND, using Oriental medicine, Oriental Chinese medicine, and naturopathy. And I find it interesting that an alternative method is being used in different parts of the globe for not just autism, for facial paralysis, for Alzheimer's, for speech. And I've invited him to come and share his expertise, his knowledge with us. Interestingly, he told me that tea leaves, is something that they widely use in Oriental Chinese medicine. And we're going to hear from him. So till then, let's complete our facial yoga capsule. And then by that time, our esteemed speaker would be joining us. Okay, so what do? We start with a yes, the face yoga yes. So what do? We say yes, right? What do? Yes, perfect. Okay, I want you to touch with your index fingers the corners of your mouth and exaggerate and say yes. Excellent. Good job done. Again. Yes. And relax. Okay, some of us may need a little assistance. So take the index fingers, place them at the corners of the mouth, and then ask them to say yes. And slowly, if they need help, stretch the index fingers. So place, stretch, yes. Relax. Again, place the index fingers, the corners of the mouth, and stretch. Yay! And relax. Again, Place and stretch. Yes. Excellent. Good job done. So, our first exercise is, I want you to open your mouth, nice and wide, and then fold your lips over your teeth. Hold the position and forward. And relax. Again, open your mouth, wide, fold, and relax. Smile, keep smiling. Again, open your mouth, wide, fold, and relax. Good job. Pat. Pat your cheeks. Excellent. Pat your chin. Very good. Excellent. Okay. Now we're going to do what we always do, the balloon. Everybody knows the balloon. So what you're going to do is blow air into your cheeks. And relax. Yes. Again. You're so good. You're doing very well. Again. So take air. And relax. And again. Take air. And relax. And pat. If you need to help somebody, what do? We ask them to blow air into their cheeks as though they're blowing a balloon. And count. Count to 2. That's fair enough. Count to 5. Whatever works. 4. 4 is fine. And relax. And again, ask them to blow air and count. 1, 2. Can you do 3? Excellent. And relax. And just pat. Pat your cheeks. Good job done. Excellent. Now, what I want you to do is just with your mouth and your tongue, focus on saying the alphabet A. So it's A, A, A. 3 A's, 3 different strengths. So the first, A, A, A. Excellent. Good job. A, A, A. Again. A, A, A. And relax. Pat your cheeks. Pat your mouth. Chin. Nose. Again. In a circular format. Excellent. Again. Yes? How do you say yes? Yes. Again. Yes. Good job. Okay. So one more round of A. So it's A, A, A. Again. Can we repeat it again? Of course we can. So what do you say? A. Then A. And then A. And relax. Okay, pat your cheeks. What I want you to do next is just look at the ceilings. Okay, but with your eyes closed. So you're looking up and closing the eyes and holding the position. Holding the position, you're looking up, closed eyes. 1, 2, look up. 3, very good. 4, and relax. Can you feel the pressure here and on the occipital globe? Okay, the back of your head. Again, look up, close your eyelids, and keep looking up. 1, 2, 3, 4, 5, and relax. Again, look up, hold the position, keep looking up, close your eyelids. 1, 2, 3, 4, 5. Keep looking up with your eyes closed and relax. Okay, just pat your eyes in a circular manner. The other side, very good. Again, very good. Now, what I want you to do is, I want you to raise your eyebrows. So we have the frontalis, the temporalis, all these muscles working, and the orbicular line. So look up, eyebrows up, smile, and slowly close your eyelids and hold. And hold. Keep your eyebrows raised. Let them touch the ceiling. And look up. And look up. Excellent. And relax. Good job done. Yes. And we're going to continue. Again, eyebrows up. Looking up. Hold the position. Slowly close your eyes. Relax. And smile. And 1. And 2. Eyebrows up. Hold the position. 5. And 6. And relax. Tap. 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 And one last round. Raise your eyebrows. Look at the ceiling. Hold the position. Slowly close your eyelids. Keep looking up. Keep looking up. Excellent. Good job. Hold the position. Hold the position. 1. Very good. Eyebrows up. Keep looking up. You can feel the stretch in this entire area. And relax. And just tap. Good job. Very good job. Okay. Now what I want you to do is hold your neck. This is the platysma. Okay. It's a thin muscle here, which is your neck muscle. Hold the position with both your hands and smile. And relax. Again, hold your neck, cup them with your with your palms and smile. 1, 2, very good. 3, 4, smile. 5, 6, and relax. Okay, one more time. Cup your neck, hold the position and smile. 1, 2, 3, smile. 4, 5, and relax. Tap. Tap your neck. Tap your neck. Excellent. Good job. If somebody needs help, either place your palms on his neck or his palms on his neck and ask him to just say yes. Yes. And relax. Again, place his palms or your palms, press gently and ask him to say yes and relax. Good job. And now just tap, tap. Excellent. Okay, with this, we're going to welcome our guest, Dr. Tirthankar Roy. Tirthankar, I can see you're in the window, so thank you for joining us and welcome. Hi.
Am I audible?
You're audible. You're quite clear. So I'm going to just read a little outline about Tirthankar. He is a Bachelor of Naturopathy and Yogic Science, and his journey into holistic healing is a combination of a personal odyssey and family influence. Family influence because his father is quite knowledgeable. He's a practitioner of Oriental Chinese medicine. And this has enriched and I think motivated Tirthankar to follow this particular line of medicine. In fact, his father is a physician who has been Oriental Chinese medicine, and as I have been interacting with Tirthankar, I saw a wide depth of knowledge and ability to think, which comes from being, I'm sure, like an understudy with his dad during his growing up years. And I think it's commendable. Tirthankar has treated a diverse spectrum of patients from autism, Alzheimer's, Parkinson's, DMD, MS, spondylosis, depression, with not just naturopathy, but acupuncture and Chinese Oriental medicine. His naturopathy for managing osteoarthritis, knee and lumbar spondylosis is also a very interesting journey. What I want to add is today I asked him to talk about something which is very different, using a tea for neuro conditions, tea for autism, and I think it'll be a very interesting interaction, and we will definitely have a wide knowledge base that we will take away as a takeaway rather. So Tirthankar, I'm going to hand this over to you, and please join us and everybody who's joined us on the Facebook Live today. Thank you. Over to you.
Tea, from like ancient time, tea used as a medicine in China and in India also. There is a debate in the origin, with the origin, where it is basically from, but Chinese practitioners, Chinese Oriental physicians are using tea leaves from like 5,000 years ago. From when I've treated patients with tea for psychological disorders, for neurological disorders, that comes a quite good result. So I lean into it, and I wanted to know what are the properties, how it is working. So I have the mainly biochemical properties of tea is epigalactogalacan. It is tannin. It is one type of tannin that is present in tea, and it is quite strong antioxidant. It is a natural antioxidant, so it reduces oxidative stress. Actually, now in the modern time, it is the main factor, main reason of any conditions is oxidative stress. When oxidative stress rises, there is we don't take many healthy fruits or vegetables that has antioxidants. So basically what happens is our body start to react in that way. In oxidative stress, basically what happens is when there is maximum oxygen, there is like oxygen poison in our body. Oxygen is good for us, but overdose of oxygen is also bad for us. So there is a strong antioxidant that is EGCG, and there is electrolytes, alkaloids and electrolytes, caffeine, thrombin, theophylline. Caffeine, it is neurostimulator. It is a neurostimulator. Theobromine, it is it has a diuretic effect. It works with our kidney. It produces water. It releases water that metabolizes the oxidation or those things. And theophylline, it relaxes the smooth muscles, mostly airways. So in neurological conditions, it helps in Alzheimer and Parkinson, mostly helps in Alzheimer and Parkinson. And there is one more thing in tea, that is L-theanine. It is amino acid, and it has a range of works in our body. It stimulates the GABA path in our body, that is gut-brain axis, where it produces serotonin, it produces dopamine, and that really helps in neurological conditions. Not only neurological condition, it also helps in psychological conditions. Most musculoskeletal disease or digestive disease, that when it is a chronic disease, that goes to psychological condition, it triggered by our psychological condition. So tea helps in all of those diseases. And one more thing is that polyphylins, that is polyphylins are really rich in tea, and it also works in ASD because it has that oxidative stress relieving factor. There is a range of vitamins and minerals in the tea: vitamin C, vitamin E, K, vitamin B, B12, B3, B2, folic acid, and potassium, magnesium, those things. So it helps in immune system, protects the cell, blood clotting, bone health, those, all of those things comes under that. So there is one more important thing about choosing the tea. There is a various range of tea available in the market right now. There's green tea, black tea, oolong tea, white tea, and then herbal tea. There is eucalyptus tea, various kind of teas. So basically, different teas have different kind of benefit. Just like we've seen in the advertisement, green tea reduces weight loss effect. Uh, with that, green tea has also cognitive effect. It enhances our cognitive functions. And black tea has oral health effect. If anyone have a gum problem or any teeth cavities, those kind of thing, if they gargle black tea in the morning, that really helps in that conditions. Or even in mouth cancer has there is not much research around this, but there is great benefit of black tea, and that controls the BP also. In oolong tea, that works basically on digestive system and skin. It really works in the skin, and the this treatment goes very well with the acupuncture. So that's how we can combine these things. And comes to the autism. In the individual response is very important in autism, particularly in every neurological cases, but in autism it is different with every individual. So when we any kind of treatment, or in this case if we introduce a tea, then we have to observe the changes with that. If it gives 2 times or 3 times, there will be some changes, physiological or behavioral, any kind of changes. If there is any changes, if it is bad or if it is good, we have to observe that change. So we have to observe that, and we have to change accordingly. So, and the one of the most important thing is to choose the right kind of tea. In the case of autism, and whatever research have been done, that shows oolong tea, black tea, and herbal tea. These three kind of teas are works the best around autism. And one more thing, tea has, like I earlier mentioned, that L-theanine, that amino acid that has like a miracle effect on the body, that can goes around blood-brain barrier. It goes straight to the brain. So when we consume through our gut, it goes through that blood-brain barrier, and it stimulates our neurons immediately. So that's how we have that effect. When we are stressed, we drink tea, and there serotonin releases, and there is some relaxation, there is stress relieving factor that comes like that. And it has really good digestive effects. It produces really good bacteria, that gut bacteria. And autism not only a neurological condition, it also a psychological condition. It affects our psychology very much. So there is many research around how gut affects our emotions, gut affects our moods, and how gut affects our psychological pattern. So if there is good bacteria present in our gut, then that will enhance that effect. It is an indirect approach, but it has some good result around tea. And with acupuncture, it always a great combination. This both of these. So Camellia cincea, it is the base tree of the tea, and it has good effects around the autism, around neurological cases. And it tea and acupuncture has kind of similar effects in some aspect. It also produces serotonin, it also produces a hormonal cocktail. So when we prick a needle, it also produces a hormonal cocktail. It because of the damage of the pricking, that body goes to a survival mode, and it produces a hormonal cocktail. And when we consume tea, it that L-theanine, that GABA reaction, all of those reaction, body also goes to a survival mode. So sometimes we have to push body to the survival mode to give that environment, that body can heal itself. So when uh, otherwise those hormones wasn't produced enough, that's why that condition occur. So if we help to produce those hormones, the body will correct itself that imbalance. Yeah.
Tirthankar, I wanted to ask you now, when you're saying tea, is there a particular way that the tea is made? For example,
Yes, never according to ancient Chinese method, they never put any kind of silver, any kind of metal. It, tea shouldn't touch the metal, because when we are making the tea, the metal and the components of tea, whatever I have discussed right now, that has a reaction. So it hot water and the tea leaves. Those put the tea leaves in a kettle and hot water, and put it for like 7 to 8 minutes. It will the tea leaves will flourish, and the tea is completed. If there is a possibility that you can take it without sugar, that is the best way to take it.
glass, how you have the coffee press, the French press. So you've got the
Yes.
glass. You can put tea leaves, and you can just put hot water, let it.
No, again metal. When the tea leaves flourishes, they don't float, they comes under. Actually, it is in the below. You can take the tea from the kettle. So yeah, if
Got it.
There is something like that in with made with mud also, that pressure that made with mud also. Yes,
Right.
you can use that. No metal should touch the tea.
Interesting.
If you add sugar, use it with a wooden spoon.
Okay. Again, metal.
Again,
Interesting. Interesting. So you're talking about chemical reaction, and this is so now. This tea, which is more like a herbal, whatever, just the water which is just for infusion of tea, can be drunk by those. I mean, the children, adults, even the parents and
yes,
caregivers, for everybody.
yes. Doses should vary. If you are giving it to a children, then 40 to 60 ml once a day, and just observe the changes. If
Okay.
he or she has any condition, observe the changes, or what is the effects of the tea, and then according to that we can vary the ranges, vary
Yeah.
the ml.
Adults can, of course, take a glass or whatever.
Yeah, 2 to 3 times. That is a
Yeah,
normal range.
because we have a lot of parents, we have caregivers, they also need to
Yeah.
come down to balance. They are, a lot of them
Yes.
don't take care of themselves, so everything, it would definitely help each
Yes.
and
If those adults caregivers don't have any particular condition, then they should take like normal oolong tea. Oolong tea, it is mostly found in Darjeeling, near to my home. So it has all of those things, all of those characteristics, but not in a major way. It doesn't have much tannin, or it doesn't have much caffeine. It is a fine line. It is a fine balance. So they can take that. If
perfect.
anyone has insomnia or something like that, they should take like their dinner should be at 7 to 8. After that, 9:30 they can take a cup of white tea, and then around 10 they can go to sleep. That will give a good result, really good result in insomnia or depression or anxiety cases.
When you say white tea, no milk, just plain tea,
No, no,
right?
no. Plenty. It is mostly produced in Japan, white tea. We import those tea in India, but that tea has really good effect. That tea uh, doesn't have much caffeine, doesn't have much tannin. Also, it has mostly L-theanine and the minerals, and it has like EGCG, that antioxidant properties. So it doesn't have the bad things in the tea, which now modern science are calling bad things like caffeine and tannin. But those things also needed in our body, because those things creates chain reactions in our body, and that gives a really good production of hormone.
Okay, one white tea. So you're talking about the white, this thing. And
White
anything
tea.
that you'd like to just share, because this is a very interesting aspect. Uh, tea medicine, neurological conditions, and also for the
Yes,
caregiver.
yes. So in Ayurveda, we talk about herbs. In Ayurveda also, there is a mentioning of tea. Many Ayurvedic medicine needs tea to some properties of the tea to function. So it is like a herb. So when you take it as a medicine, it works the best. Not with milk, not with sugar. We shouldn't burn the tea like in the oven. It will boil. It really burns the tea.
Correct.
So that gives us that strong flavor. So
Right.
we shouldn't do that to the tea.
Okay.
It is a herb. We should take it as a herb.
And give it that respect, due respect, and our
Yes.
for our
If you give the proper respect to the food, if we talk about the food, we don't take food the way it should. Uh, we use like packaged food, those kind of things, fermented products, and those products really, our body is not a dustbin. So why we're putting all of those stuff, those we should put in the dustbin, we're putting in our body. So that gives a really bad effect. And like that gives another chain of reaction, and that chain of reaction results in hospitalization. Yeah.
okay. So we'll stop on at that. It's been nice to hear from you about tea and how it can help neurological conditions. We're talking about
Yes, with not only tea helps neurological condition, but with some other treatments, it always should be a holistic approach, a combined approach, because there is really good effects of naturopathy in neurological conditions like mud therapy, hydrotherapy with acupuncture. Water, mud has like magical properties in them. if we use it correctly, that gives a really good complementary effect to the tea. Really
Okay.
does.
Interesting, interesting. So with that, I'd like to thank you. And I'd like to also invite you once again where we can talk about autism, of course, but with face yoga and beauty with acupuncture for our mothers, for our caregivers, for friends,
Yes,
for, with all our autism spectrum children, adults, everybody who's there, but
yes.
support system. And it'll be nice to talk about this. So the next session, I think I'd like to invite you and then we'll talk about it further. Yes. Thank you so much. So
Thank
goodbye
you.
for now.
Thank you. Thank you for having me. Bye.
A pleasure. Bye bye.